Parenting is hard, but this is easy. Listen to Stroller Coaster, hosted by Lynn Smith, a mom and former news anchor for NBC, and co-hosted by an improv comedian. And it's a place to be entertained and to laugh over crazy parenting moments and to learn something new. Stroller Coaster was voted Best Branded Podcast 2024 by Digiday, and Stroller Coaster is created by Munchkin, the most loved baby lifestyle brands in the world. I just got done listening to their transitions episode and I really resonated with it. And I just loved how they were talking about kids really needing to have that connection piece before we can expect them to follow directions or to transition easily or to get their shoes on, get out of the door, get in the car. I just felt so seen as a toddler mom. And this season, they're talking about things that we really all should be talking about, like how to stay connected with our kids once they're in daycare, how to hold on to your patience as a parent, why kids are so obsessed with snacking, and the hilarious but important process of making friends with other parents. So follow Stroller Coaster on Apple Podcasts, Spotify, wherever you get your podcasts, and make sure you leave them a rating and review. Welcome to No One Told Us. I'm so excited for this episode. I'm your host, Rachael, and today we're welcoming Dr. Ben Miraglia. Dr. Ben graduated from SUNY at Buffalo School of Dental Medicine in 1993, and he has over 30 years of general practice experience, including over 20 years of orthodontic experience, where his focus has been on early childhood, jaw growth, and development. He also lectures nationally on airway and sleep-disordered breathing and early treatment options for children. He's the VP of GP Clinical Education at Candid Pro, the Chief Clinical Officer at Airway Health Solutions, and is on the board of directors for the American Academy of Physiological Medicine and Dentistry. He's also a founding member and Chief Clinical Officer at Toothpillow, which is an amazing resource we will talk about later. So, Dr. Ben, thank you so much for being here on the podcast. This is something that I speak with my audience about a lot because these issues do impact sleep often in little ones, which we will get to. But first, I would love for you to just kind of tell us a little bit about your background and how you started your business and this kind of specialty.
Sure. Yeah, thank you, Rachel, for that kind introduction. It's fabulous to be here. I'm very excited to be participating. And yes, getting the message out to parents is very helpful because it makes a big difference if you know you have choices, as opposed to not even knowing there's something available for you. My dental career began 31 years ago, so I am 31 years into private practice, but about 10 years in, I pivoted. I went from fixing teeth to doing growth and development early. So I was a tooth fixer for a while and very successful. I enjoyed it. It's not bad, but 10 years in, I realized, hey, there's a little different approach we could do here. I started taking courses, learning about treating children early, and I started learning about the connection between underdeveloped jaws, poor breathing, poor sleeping, unhealthy children. And of course, why are we waiting until 12 to make braces when that doesn't help the jaws? It only makes the teeth straight, temporarily, I might add. Mm-hmm. So all of a sudden, the light bulbs went off. I'm taking courses, I'm learning things, and we started to recognize that, we probably should be treating the kids between 3 and 11. Mm-hmm. And the earlier we treat, the better. 21 years ago, I started doing this, and after about a decade of treating children early, we had compiled such incredible changes and results, I started to teach it. And then teaching it to other offices helped because then the ones who are interested in learning took classes, they learned, they brought it to their communities. Now more kids are getting earlier attention. But even then, fast forward like 7 years later, it's a small amount of dentists actually take on the role of doing growth and development in younger kids. So we then built a company. And so a bunch of people and myself became founding members of Toothpillow. And I know we'll get to what all that is later, but the whole point was to solve for access and affordability. How could we build something that would give kids access anywhere to early care? And then how could it be more affordable for them? And that's how kind of Toothpillow was born. And I know that those questions will come more. We'll get into the details later.
Yeah, that's so interesting and so important. My son has been, getting all of this type of work done for the last couple of years. He had an expander and we've, definitely been through a lot of different things, and it's definitely not cheap. I'm really glad that you're doing that for families to make it a little bit more accessible. And it's also so interesting that you talk about this like early preventative care, because when we were kids, at least me, I had braces for probably 6 years, almost 6 years in my early teens, and my teeth are crooked now. And I'm like, I already need help again. It's so interesting. And I have one sister who had, I think, 10 teeth pulled in our childhood. And it was like
heartbreaking.
Yeah. And it's just so interesting that we had no idea, and my parents obviously had no idea what other options there could have been, or like how to treat it in a more preventative way earlier. So maybe a good place to start is, what are the signs and symptoms that you would see in a child that would tell you they need something like this? Because of course, not all kids need this type of care, but probably a lot more do than we even realize. And so one thing I'm always talking about with my followers is mouth breathing. And so I would love if you could explain to us what mouth breathing is and why it could potentially be a big problem.
Absolutely. Yes. So yeah, big question. So let's just start with some of the signs first that parents would see, and then we're definitely going to be specific about the mouth breathing. So signs that you would see, kind of two categories. One would be like looking at the mouth. And so let's say we have baby teeth, that 3 to 5 year old child. One of the telltale signs that the jaws are underdeveloped and there might be some symptoms downstream would be that the baby teeth are actually close together. No spaces. So it turns out there was a gentleman who did research on the baby teeth way back when, and he learned what the distance between them should be. Like, what kind of space should baby teeth have that the permanent teeth would come in nicely? And it's the width of a nickel.
Whoa.
It turns out the width of a nickel is the gap that should be between baby teeth if we're going to grow up and get all our permanent teeth coming in very well. So if you think about how many children do we know who grow up and have all their teeth come in perfectly and they never need braces or anything like that? That's very rare. Most kids have some sort of crowded teeth and a bad bite. Well, it starts early, it's visible early. So the number one thing a parent might see is that I don't really see many spaces between the baby teeth. And to have a perspective or frame of reference, if your child were growing perfectly, you should see a gap between all the baby teeth that resembles the width of a nickel. That's a big space. Now you know, hey, I'm on the right track. So the space between the teeth, number one, which we don't see much of. So usually you'll see the baby teeth together, like lined up perfectly. That's not a good thing. Oh, they're cute. They look cute, but it's not perfect, not where we want it to be. But now, besides looking at that, then there are symptoms that we might actually be living with, struggling with, that we know all too well, but meanwhile didn't connect the dots yet. So at the top of the list is that ADHD or behavioral category. And yes, when children have behavioral issues during the day, and it could be in the attention category, the hyperactivity, the lack of focus, kind of all of the things that make up the symptom list that goes into the ADHD diagnosis. When you're thinking about that behavior during the day, a lot of that can be coming from the poor night's sleep. And a poor night's sleep can be coming from poor breathing while you're sleeping. And sure enough, that research was put together by Dr. Karen Bonnick, brilliant researcher. So Bonnuck, I would encourage people to go. We send all our patients to her YouTube. Dr. Karen Bonnick, Sleep Disorder Breathing Children, YouTube. All the videos of her being recorded, basically it's interviews. Her being interviewed by the news, telling her research, her stories, her results, connecting poor breathing while sleeping in children is related to the behavior the next day. So she connected it to that, but she also connected it to cognitive development, basically IQ, intelligence. That poor breathing, the worse your breathing is at night, the more you will struggle cognitively. So basically children who are mouth breathing or worse at night have lower IQs than children who nose breathe at night. So parents would recognize in the behavior category that, oh, there's a connection here to my child's sleeping, breathing, and certainly jaw development is at the back of that list. Okay, after behavior, the common symptoms we see a lot of, bedwetting. Then there's digestive issues, and it could really be anything in the digestive category, from a little reflux to constipation or diarrhea or stomach aches, anything that is digestive. So we got bedwetting, digestive issues, headaches, nightmares or night terrors, then just waking at night in the middle of the night, not sleeping through the night. If you wake up every few hours, that's disrupted sleeping. There's something wrong. Usually the brain is waking you up because it knows it has to improve your breathing. It makes you get up, reset your breathing, then you go back to bed because you're breathing so badly. Your brain thinks, hey, it's better if you're awake. Even though it's the middle of the night, we have to wake you up to breathe better to go back to bed. So waking in the middle of the night. Grinding the teeth is a big one. If your child is grinding their teeth at night, clenching or grinding, that's a big sign that they're struggling to breathe well. And there's a total connection of poor breathing leading to grinding of the teeth to actually improve the breathing. So that's all built out for us nicely. Then there's just that restless sleep category where we say the child might be wrestling around in the bed. The arms and legs are flailing around. It could be anything from head movement, rocking the head around, tipping it back, head movement, limb movement, whole body, full acrobatics and wrestling, all of the little to big movements. Certainly restless sleep is related to poor breathing, and the poor breathing is related to the underdeveloped jaws. So there's a very long list of these things, but it does even include downstream anxiety, depression, weight gain, sensory issues. A lot of things downstream can be related to poor breathing and poor sleeping. When we disrupt the proper sleeping cycles, very bad things happen to any age, really. If you have sleep fragmentation, basically the professional way to say you're sleep deprived, your sleep is being ruined, you have a long list of symptoms downstream, and ear infections are another one of those. So we do have a lot of kids with this list of things: behavior, bedwetting, ear infections, nightmares, night terrors, digestive issues, anxiety, depression, weight gain, inability to sleep through the night, restless sleep. Certainly school issues stem from the behavior and cognitive struggle from the poor night's sleep. So we would see school issues, whether it's behavior or academic. We see children struggling there. So basically we start talking to parents that if your child is having any struggle anywhere, whether it's home or school, and it might be considered, let's say, a medical symptom, or we should think about it could be related to the breathing, sleeping, and jaw development. And we don't treat the medical symptoms because we're not diagnosing, oh, you have ADHD, let me make your jaws bigger. Like, we don't diagnose and treat that way. We basically think about these things are downstream. Those are symptoms. Well, let's take a look at the child and make measurements and see, are they underdeveloped? Do we see baby teeth together or crowded permanent teeth? Well, then the jaws are too small. If the jaws are too small, we might have trouble breathing well. And if we're not breathing well, we're not sleeping well. So it's a connected thing. How about if we treat what we diagnose, the bad teeth and bite, the underdeveloped jaws, grow the jaws, improve the teeth and bite, and do the symptoms fade away? This is a pathway to help a child. Specifically, though, you said mouth breathing, so we should talk about it. I do like to teach parents the difference. There's a big difference between nose breathing and mouth breathing. So nose breathing is perfectly healthy for a human being, and we are obligate nose breathers. We're supposed to breathe through our nose. Our mouth was not really made for us to breathe. It just so happens to be that it's a safety valve in case our nose, let's say, suffers compromise like injury or gets clogged up and we can't breathe through there. It's better we can open our mouth to keep living, right? So it's a total safety valve. But I like to teach parents the difference between nose breathing and mouth breathing like this. We're going to pretend or use the analogy that our child is a Ferrari. So, or your favorite exotic car. Your child is a Ferrari. Now, if we have a Ferrari, there are ways to fuel that Ferrari. The Ferrari needs fuel to perform at its best. Well, we think about breathing is going to be our number one fuel. So a human being needs to breathe. We need air, but it depends how it comes in. So the air coming through the nose is basically set up perfectly to go into the lung, and it's filtered, warmed, cleaned, humidified. Ingredients are added. The air is so well prepared coming in the nose that when it gets to the lung, it is perfect, pure air for the lung. The lung gets to do its job perfectly, which is exchange. So the lung's got to bring in the goods and get out the bad. It does it the best when we breathe through our nose. It's like putting the high-performance octane gasoline in the Ferrari. It runs around the track and it wins the races. But now if we're going to be breathing through our mouth, the air doesn't get filtered, warmed, cleaned, or humidified. No ingredients get added. Breathing in the mouth is like putting a watered-down, cheap gasoline into a Ferrari. It might get around the track, but it will not win the race. It will malfunction. Now we have this Ferrari that is going to underperform in pretty much every category. Breathing through the mouth is equivalent to putting in really bad gasoline into a high-performance car.
That makes total sense. I think that analogy will really help people understand. And we're going to take a quick break, but I do want to clarify something that a lot of parents ask me, especially when they have a little baby. And I think you're mostly treating, kids that are 3+. But when they have a little baby, they're wondering about this and worrying about this because they're saying, oh, my baby is sleeping with their mouth open. So when we come back, I just would love for you to kind of clarify some other potential reasons why that might be happening. We'll be right back. Okay, so we know that mouth breathing in children is not ideal. Does mouth breathing always mean that there's a dental issue, or are there other things that could be going on? Things like tongue tie or congestion or enlarged adenoid, tonsils. Can you talk a little bit more about that?
Absolutely, yes. It turns out that most of the mouth breathing we're going to find is because the jaws are undersized. When the jaws are undersized, it does make for poor airflow because what we loosely say is our airway, or the tube that we have to breathe through, is a space, and that space that's left behind from the jaw growth and development. So when the jaws grow really well, we end up with a big space to breathe. When the jaws don't grow well, we see crowded teeth, but we have less space to breathe. So that's the number one reason. However, there are other reasons we might mouth breathe. And so certainly we could think about the allergy and nutritional category, because you could have an allergy that causes inflammation that prevents you from breathing through the nose. And whether it would be, let's say, a dog or a cat or the birch trees in the front yard or some sort of seasonal or even a food. And now not every food allergy has to be like, okay, anaphylactic shock from eating peanuts, right?
Right.
You could have a sensitivity level where you're eating this food and it doesn't really cause you an immediate distress, but meanwhile it's causing inflammation, which is leading to poor breathing. And so we don't necessarily connect a lot of the food things to an allergy that our breathing would be worse, because generally people think, oh, if I had an allergy to food, I would have some sort of big reaction that I know not to eat it.
Right,
That's
like a big
the serious
rash or
category.
something. Yeah.
But it could be, and in a lot of cases it happens to be in the dairy or gluten category where people are having it on a daily basis and they're living in a state of inflammation and we can't breathe very well, but not like an anaphylactic shock where they know like, yeah, I won't have that again.
Yeah, exactly.
So yes, so nutrition category, environmental category, where there's like these things that cause inflammation, certainly. You mentioned tongue tie, tongue, lip, or cheek ties, certainly. When we have ties, those actually do prevent us from growing well. So it turns out that tongue, lip, and cheek ties affect the growth and development. We usually see less jaw growth and development when there are tongue, lip, and cheek ties, and it does prevent the tongue from really getting into the palate to make for good breathing. So sure, having physical ties that are in need of help and release can really produce some bad breathing too. So we certainly have underdeveloped jaws lead to bad breathing. We have ties like tongue, lip, or cheek ties can lead to bad breathing. And then we have that category of response to environment, whether it's the food source or the outdoor activities that we do. Basically, environmental or food allergies can lead to. Then there's, a whole nother pathway where we can have pets in the house that we might love so much, but it could it could be tough to breathe. And so many kids have these little pets. It could be a dog, a cat, a gerbil, a hamster. It's the fun, cute stuff, but meanwhile, they can't breathe well with it.
Yeah.
So there's a number of reasons. It's not just small jaws only, but predominantly that's a pathway to it.
That's what you're saying. Okay, so that's really helpful and really interesting. And I think the question that most parents would ask next would be, okay, so how do I know? It's helpful to know that there's all these things, but it also can be really overwhelming, especially for a new parent, or like this is your first child or your only child and you have no idea where to begin. So I guess my question is like, how do you kind of narrow it down, or what professionals should you reach out to first?
Oh, sure.
So what I hear a lot is parents bring up certain concerns with a pediatrician. The pediatrician is kind of like, oh no, that's normal. It's fine. It'll go away, or it'll get better. And then maybe it doesn't, or, how does a parent know kind of which professional to seek out help from first, or to get their opinion from first?
Yeah, I can second what you just said, that we meet a lot of people who, when they go with their concerns, because what parents don't bring their infants in with concerns or their children in with concerns? Of course we go. And they are told from some in the medical community that, oh, that's normal. They'll outgrow it. That's not something to worry about. That's not a thing we think about or worry about. And they get these different answers. But meanwhile, the child is in distress, really. They're struggling. Mm-hmm. So we do encourage, and even earlier than 3. So while we might be able to treat from 3 on, there are things you can do between 0 and 3. Certainly in the earliest stages, there are lactation consultants that are wonderful early on, because one of the first signs would be maybe a struggle with the breastfeeding or the nursing, that it's either uncomfortable and or unsuccessful. And then, okay, lactation consultant, let's get in there to see, are there ties that could be affecting that, or is there just better or instruction needed to maybe make that successful? Mm-hmm. Because that will help get things going in the right direction. Certainly after that, we do have what are called myofunctional therapists. And oral-facial myofunctional therapists are excellent with pretty much all age groups, including the younger ones, to get involved earlier to help the children. And then you have speech-language pathology. There are body workers that are very good at all the ages. You can think about craniosacral people, osteopath, chiropractor. There's a lot of specialties out there that are maybe less known, but can work with infants younger and all of a sudden start to do manipulation to help head in the right direction, because you do want to be growing well and breathing well and sleeping well all throughout.
Mm-hmm.
And then, being evaluated by some of these can show up where the ties are real, and then they do get releases at younger ages, which is very helpful. There's a whole nother category where parents can kind of seek attention, which would be the earlier group, that's 0 to 3, where it's kind of the newborn or the infancy. Definitely check out programs that involve the kind of topic of baby-led weaning. There's a wonderful book out there, Jill Rapley and Tracy Marquette. I reference it all the time. I refer parents to it. Baby-led weaning is basically an instruction manual. How do you introduce your infant to solid foods? Like, how do you transition to solid foods earlier? Because if we transition to solid foods earlier, the muscles would work harder and the jaws would grow better. So getting away from the softest baby food much early helps us grow better. So baby-led weaning, solid starts. There are groups out there that give instruction. And I know I hear, like, nobody told us getting instructions on raising children. That's a really big direction to go in to learn how should I be feeding my child at different ages? What's the right size of the food, texture of the food that they could handle? And the groups like baby-led weaning and the solid start people help to get the parents on the right track. So the good news is there's a lot of resources out there. You're one of them. Like your podcast is one of them, because you start giving parents help and instructions because their baby didn't come with a manual either.
Right, exactly. Yeah. And I love that you mentioned all of that. And we've done episodes with Solid Starts and other baby-led weaning specialists, done tons of episodes with SLPs and lactation consultants. Yeah. So we're always trying to look at that full picture, because it's like you said, it's like a puzzle piece. And my own son has gone through this journey I've been through. So many different people to help him. And I'm glad you mentioned myofunctional therapy too, because we did start that with him kind of before we went the more orthodontic route. And a lot of parents worry that they're like too late. And I'm like, no, just start whenever you can. And honestly, my myofunctional therapist wouldn't even start seeing us until he was 4, because she was like, before that, they can't even follow directions. So it's like, it's really hard. I know that there are probably people that do more hands-on, but this was like during COVID. So I couldn't get anybody to see us in person. So yeah, I'm really glad that you mentioned kind of that like holistic full team point of view. I also wanted to ask you about a couple of like maybe tools that people either should or shouldn't use, like mouth taping, pacifiers, things like that. So we're going to be right back and talk about that. We're going to take a quick break. Okay, so while we're talking about babies, I first want to ask you about your opinion on pacifiers, and are pacifiers contributing to these problems getting worse? Is there a best time to stop using a pacifier if you're currently using one, or do you have no opinion on this?
So I do, and I'd love to start by saying that my children had pacifiers.
Same. Yeah, my oldest too. Yeah. No judgment zone.
No judgment zone. And absolutely the honest answer is that I did everything wrong from the start. So mine are 24. Oh my goodness. 24, 23, and 17. So my children had, when they were little, the pacifiers, because I started this about 20 years ago. They were turning 4 years old and 3 years old. So for the first couple of years, we're giving these pacifiers to them and stuff. And my wife had to go back to work, so we're using a lot of bottles. So I did everything wrong from the beginning. And so basically, no judgment zone, but here comes my professional opinion. We do know from the anthropology research that the transition from having like good teeth, well-developed jaws, which was very common. It was the overwhelming majority of the human race had well-developed jaws and very nice teeth and good bites prior to the early soft food. And all of a sudden, when cultures start to become what we call advanced or industrial or Western living lifestyles, the early soft food becomes so soft and for so long that we lose our muscle strength. So if the food is really soft and we lose our muscle strength, well, then the bones don't grow. So form follows function, and bone yields to muscle in a human being. Our jaw bones grow predominantly by how we use our muscles early, and most of it is from 0 to 2 years old. So the majority of our jaw growth, about 54%, is 0 to 2. So if we're using softer foods, it makes the muscles weaker and dysfunctional, and we basically turn into like a drinking human being rather than a chewing human being. So our bones won't grow. Now, building one step to the next, early soft food is our number one problem. But here comes my opinion on the bottles and pacifiers, because that's problem number 2 and 3. So the bottle and the pacifier, even though the bottle can give you nutrition, the prong gets between the tongue and the palate. So when you put the bottle in the mouth, it holds the tongue low. And if the tongue cannot work up to compress to produce a vacuum swallow, we don't get any jaw growth. We just get the drink. It basically promotes the drinking swallow as opposed to a compression, chewing, hard food swallow. So we don't get jaw growth and development from a bottle. It pushes the tongue down, but it also makes the lips and cheeks work. So as the bottle makes the lips and cheeks kind of work, well, now the work is being done outside and the tongue is held back. That makes you shrink. Like now you're going the wrong way. We need the opposite of that. So we need the tongue working hard and the outside doing nothing. That's where breastfeeding begins the whole process. The tongue does all the work with compression, and outside we just seal.
So it's a different mechanism between...
Yeah, it changes the mechanism of the muscles, which changes how we grow. And the pacifier might be the worst of all 3 culprits, because when the child puts the pacifier, I'm going to do this for your audience, this is for your audience, but here comes using a pacifier.
Great visual, great visual.
Making myself, vulnerable for your audience. But a pacifier overworks the outside muscles, but it does get between the tongue and the palate, so it pushes the tongue down. We need the tongue and the palate for growth, and we need no activity out here to grow out. So a pacifier flips the script, it pushes the tongue down, and it makes these work. So it prevents us from growing well. So basically, early soft food, bottles and pacifiers set the musculature up so our jaws don't grow well. And what we see is baby teeth together or crowded, bad bites, and then permanent teeth coming in all crooked and out of place. And then, we need years of braces and extractions, because all of the things we see, the teeth, that's the symptoms. The cause is really the underdeveloped foundation. And then we can talk about the big difference in that braces treat the symptom, not the cause.
Right.
So the only tiny benefit you get from braces is you can make your teeth straight temporarily, but they do nothing for the foundation, and they do nothing for your breathing and sleeping and health. It's just straight teeth temporarily, which is why all of the early treatment is really necessary from all the different groups we talked about, and how you can begin from birth and start to head in the right direction, because no child really wants to achieve 12 years old and I need braces. That's like the last, it's the worst possible choice now, because you've left behind all of the growth and opportunities early, and you're going for the last possible thing. Let's just make the teeth straight. It doesn't help your child be healthy. It just makes them look good temporarily, because then when they don't wear their retainer, like me and you and whoever else got it, they all shift back.
Yeah, they do.
So there you have it.
No, that's really helpful. I mean, like I said, my son, we let him have his pacifier till he was, I think, like 2.5, and he had this crazy open bite and a super high palate that was, they talk about like how the palate is the roof of the nose or something like that, where, it was just making his airway so small. And so, one of the things that we regret as parents, but like when you don't know better, I mean, what can you do? So now we're paying for it with all these expanders and other crap in his mouth.
We're trying to catch up.
Exactly. So is there an ideal time, like if a parent is listening to this and they're like, oh gosh, my kid does have some of these things going on and they use a pacifier, is there a best time to stop the pacifier, or it's just like as soon as possible is usually best?
Yeah. So to just give the honest answer out, throwing it out immediately is like the best thing to do. Yeah. And I understand the trauma that comes with it. I totally understand the trauma that comes with it. It's not an easy thing to get rid of. So I feel for parents. We used them for years early on before I got rolling in this direction. So we had to endure like a good 2-3 days.
Yeah, it's tough. I know it's tough. I have a blog post on kind of how I recommend weaning from the pacifier in a way that's maybe not so traumatic. Because some kids do get really attached. Now, how about for kids that are a little bit older? Are there like any tools or things, or even for adults maybe? I mean, my husband's a mouth breather, so I am like on him about maybe you should do mouth taping. What do you think about those kinds of like trends that are kind of coming out about this now as people become more aware of this as a problem?
Yes. So, mouth taping is out there, and there are people who use it, and I'm sure there are a lot of people who do it and feel a little bit better, like you can make an improvement. I am not opposed to mouth taping. However, I'm a fan of holding that for a little bit later. In other words, if we're having struggles to breathe well through our nose, there's a fair chance that our jaws being a little underdeveloped and our teeth being crowded, our tongue might not have enough room. Now, if our tongue doesn't have enough room and we kind of keep or force the mouth closed, we're basically forcing the air to go through the nose, but it doesn't necessarily mean that it's smooth and flowing well.
Okay.
So we might be trapping ourselves into just poor nasal breathing. So if you're really a bad mouth breather, if you're snoring and have sleep apnea and your mouth breathing is so unhealthy, you might be making a tiny improvement to becoming a poor nasal breather, right? So trying to put everything in perspective, my preference would be, how about getting some orthopedics or orthodontics? Let's get some growth. Let's get some myofunctional therapy. Maybe a release could help. If we head in the direction of providing more tongue space and more education and function, you could graduate to taping as more of a last stage or later stage when you know your breathing has improved and your tongue has more room to work in. So I like adding it in a little later. I don't like to start with it.
And so I guess what I'd love to kind of hear from you before we end is about a little bit more about Toothpillow and like what you guys are doing, and just, I guess, what the different options for treatment are. I think maybe parents are curious about this, but they're like, I don't even know what my kid needs or what they're going to recommend. Is this a good recommendation? Should I do this? So can you talk a little bit about like the diagnosis process and kind of maybe the different benefits of early intervention?
Yeah, absolutely. And so having performed all this early treatment in my practice for over 2 decades, basically it led to the point of a group of people who were similar to myself becoming the founding members of Toothpillow. And what we looked at was, how do we offer this to more children? How do we get more access at a more affordable rate? And Toothpillow was born out of solving for access and affordability. Now, what it led to was, what would be the percentage of children we could treat remotely? Because knowing there are very few offices that offer early growth and development from the age of 3 on, we decided that from 3 to 12, we can treat a lot of children remotely. And the way this would work is, we built a beautiful website, and that's that toothpillow.com, www.toothpillow.com. When parents go to the website, it's built with a ton of information that connects all the dots, who we are, what we are, why we are. Basically, all the information you need to know is in there. But one of the little tabs is my child a candidate? So based off of my 2 decades and others, so several decades of treating children in the office, we built out a model to be able to deliver this treatment remotely. No office visits. And there's a significant percentage of children that can be treated. So basically what a parent would do is, on that website, is my child a candidate? They'll submit information. One big piece of information is a sleep breathing questionnaire where we go through about 25 different symptoms. And we ask the parents, is it something that is never there, rarely, sometimes, often, always, these categories. Now, when you go down that list, we start learning about the child. What are the struggles? Where are their symptoms? And these are the things we were talking about, like the behavior, bedwetting, ear infections, mouth breathing during the day, during the night, snoring, grinding the teeth, all these things you might think about. Well, once we learn all that, we also, in the app, have the parent send us photos. And basically with a prompt, it's almost like a little icon of the face and the smile and a profile, and then opening the mouth. And we can get some pictures right off the parent's phone. They can upload them. So they're given a little prompt, take this picture, take this picture. They'll upload photos. So now we have this information about the child. There are empty boxes where we ask the parent, are there any medications that we're taking? Or what are the struggles now? What else would you like to tell us? Parents write paragraphs. So they write all this information about their child, what they've struggled with over the years, how many places they've gone, where I've gone and been told it's normal, or don't worry about that, or here we have a medicine for this. All of it comes in there. I screen all the kids with another partner or two at Toothpillow. So we screen these children, and based on our experience, we know that between the age of 3 and 7, we could treat remotely almost 99% of the children, because between 3 and 7, our techniques available remotely are wonderful opportunities, and any child could benefit from them. It's between 8 and 12. 8 and 12, we could benefit remotely about 75% of the children, but 25% of the kids between 8 and 12 need expanders, and we can't do expanders remotely. So then we try to guide that family to an office that's local to them that does expanders. We try to help get them in the right place, because we are looking to make sure those kids get good attention in the right direction, as opposed to the alternative, which would be, well, wait till they're 12 or we'll start extracting teeth. We don't want them in the wrong hands either for choices like that. We believe those are bad choices today. So let's go back to the kids. 3 to 7, the majority, 99% can have Toothpillow remote access. 8 to 12, 75% can benefit from this. So what is Toothpillow? 3 things. 3 things we do remotely. Number 1 is guidance appliances. Now, removable guidance appliances are soft, comfortable appliances that look like a little mouth guard. It almost looks like something you'd put in your child and say, okay, run around the field and play football and field hockey.
Mm-hmm.
But basically that little guide, as I call it, when your child is wearing it for 1 hour a day plus overnight, it redirects the breathing and the musculature. So just like the softer food, the bottles and the pacifiers send our muscles doing the wrong thing, we put our guide in and it helps us breathe through our nose. So it's like retraining the nose breathing. While your guide is in, you have to breathe through your nose. But when your guide is in, your tongue has to go to the roof of your mouth. It has to go up. So the tongue starts going up and down for swallowing. When the guide is in, it pushes away the lips and cheeks. It gets between these. So we put our guide in our mouth, our lips and cheeks are pushed away because the guide gets between the lips and the teeth. Well, all of a sudden, when you push those away, we have the tongue working right and the lips and cheeks not squeezing in. We start growing wider and forward. So now the guidance appliance for 1 hour a day plus overnight, wonderful, number one. Number two, myofunctional therapy. We can do this remotely. So the kids are now exposed to myofunctional therapy via Zoom with an app. We begin the process of getting them screened by a myofunctional therapist and then into treatment remotely. So are wearing our guidance appliance, we're doing myofunctional therapy one-on-one with the therapist. And the third item happens to be nasal hygiene, which it turns out most parents don't even know that nasal hygiene is important, and children today have stuffy noses all the time.
Yep.
We need good education on cleaning our nose on a daily basis. So we handle nasal hygiene products that are natural and healthy and holistic, no chemicals and no steroids for children. Then, of course, techniques. How do we go about cleaning our nose? And support. Now, support is in all the categories. So with Toothpillow, we built out a team. We have a brilliant support team that is over 40 people strong that handles and communicates with the parents on a daily, weekly, and monthly basis, guiding them through all these things they need to do daily, weekly, and monthly. And then, of course, we have a team of doctors. We now have 70 doctors that represent all 50 states.
Wow.
So while I do a lot of screening to approve someone to go into Toothpillow, we do need doctors who have licenses in each state to oversee the treatment over time. So it's not a mail it to you and you're on your own. We have doctors overseeing this whole pathway. And just like the kids who would come in my office, we would have them come back at 3 months and 6 months to check them. And redirecting breathing and musculature, it's kind of like watching the grass grow. It's a slow process. You don't need to come every week.
Right.
So in our office, you'd come every 3 to 6 months. We do checkups with the doctor every 3 to 6 months. So we're totally connected. Our support team handles the parents beautifully over the course of treatment on a daily basis if needed. And then, of course, we have the doctor checking in, and we do ask it multiple interviews, whether it's daily, weekly, monthly, for photos and updates on the symptom list. Because we are looking to have that child do so well that we recognize, hey, we can see the teeth and bite improving. But really what we're looking for downstream is, are there symptoms fading away? So the goal is to redirect the breathing and musculature, get your exercises through the myofunctional therapy, get your jaws growing right so you can breathe better, sleep better, and heal.
Yeah.
And so we know if we combine nasal hygiene with guidance appliance wear and myofunctional therapy, these three things, we can do them remotely for most children, and we can have results. So Toothpillow gives a parent a 2-year process of this. We basically, for a very affordable rate, give them 2 years of our attention to get their child heading in the right direction.
That's amazing. I honestly wish that I had found you guys before. Not that I'm unhappy with our journey so far with my son, but I do love that you start with these more non-invasive things like the myotherapy and the appliance that's removable and like things that are just less invasive. I really do love that, especially for little kids. It's so amazing that you're making it so accessible. So I really appreciate you for coming on the podcast today and sharing all of your knowledge. And I hope that parents will check out Toothpillow. I will link everything that you mentioned in the show notes, so it's super easy for them to go click and check it out. So thank you so much. The last question I have is something that I try to remember to ask everyone that comes on the podcast that's a parent. And I know that your kids are not little anymore, but I would love to know, just out of curiosity, what's something that no one told you about parenthood that you wish you had been a little bit more prepared for as a dad?
Oh, yeah. So it is similar to all of this, because now knowing what I know, I wish I knew more about the early things that we did. You know, I was, you know, we ran to the farmer's market and got all the right food, but then I pureed until the blender caught fire because I thought to be the best dad, look, if I'm going to win dad of the year, then my mushy food needs to be the softest. And here I am blending this thing till it's a smoke screen. And meanwhile, I didn't need to blend it. I didn't know.
Yeah.
There's, you know, and of course, using baby-led weaning and solid starts. Now, I don't recommend anybody try it on their own. You know what I mean? Giving just someone, the infant or the baby, hard food early it's not recommended to do without support. So
Right.
I wish I knew that there was support. And it turns out there was. My children, these people were out there. I didn't know they existed. And I'm almost embarrassed that I didn't know these things. But the soft food early, I wish I knew. I wish I knew more about the bottles and the pacifiers. We would have had other choices. It wouldn't have meant my wife, was going to maybe not be able to go back to work, because she did have to go back to work at 12 weeks. But, when you know more, you can make other choices. And I would have liked to have had more choices.
Totally.
And to know, if I knew pacifiers were bad, we probably would have said, well, let's try without and see how we do.
Mm-hmm.
Maybe there are alternatives to this. And I wish I had the choices early. And so now basically for 20 years, I've dedicated myself to making sure that parents know they have choices early. And one of the things is having choices. And another one, I like to give parents permission. It's okay. I'm giving you parents permission to say no to certain things.
Mm-hmm.
Here's a big one. When someone offers you to extract your children's teeth, you say no. You have my permission to say absolutely no. And don't extract baby teeth and don't extract adult teeth, because that's never indicated. I mean, I understand the example of if you got a biggest cavity and it's an infection, you might have to take a baby tooth out early. But you do not take out teeth early. You have my permission to say no to that. And having choices early, I wish I had some of those choices back. What?
Yeah. I mean, it's kind of a double-edged sword of having kids in today's day and age. We have so much access to all this information that you didn't have. I mean, even I didn't have with my 7-year-old. It was just totally different. So don't blame yourself for what you didn't know. But but yeah, I do love that parents are given more choice now. So thank you so much, Dr. Ben. Where can people find you on Instagram, and where can they find Toothpillow? I will link it all, but just so that you can share.
Yeah, I'm pretty sure I'm very bad with the social media, but I think it's at Dr. Ben Miraglia.
That's what I have here. Yeah.
At Toothpillow.
Yes.
They're wonderful places to visit.
Perfect.
The website, as I already mentioned, was toothpillow.com. That's another good one for parent resources and education. We built that for parents to learn more. Those are good places to learn more.
Okay, awesome. Thank you so much for joining. Have a great rest of your day.
You too. My pleasure. Thank you very much.
Are you a parent in need of a laugh and a little escape? Look no further. Parenting is a Joke is the podcast you've been waiting for. Hey, I'm Ophira Eisenberg. I'm a stand-up comic and parent. And each week I chat with one of my top comedian pals who, just like you, are juggling careers, busy lives and schedules, and raising a family. You can expect candid stories, hilarious mishaps that happen on stage and at home, and just a lot of laughs. There's no expert advice here. Well, actually, sometimes a good idea does sneak its way in, but mostly just pure, relatable fun to remind you that we're all in this parenting adventure together. New episodes of Parenting is a Joke drop every Tuesday, so tune in, get ready to laugh, unwind, and maybe even feel a little bit better about your own parenting. Because sometimes that's exactly what your therapist, pediatrician, and bartender ordered. Subscribe now on your favorite podcast platform.